My name is Jodi Mullen, and I'm here with my friend Denny. And today we are going to be talking about making adjustments so that you can do home-based play therapy. And specifically, we're going to really think about how you can do that with child-centered play therapy. But that's what we're going to talk about today. It will be applicable to other forms of play therapy too. So if you have to do home-based work, Denny and I are the people you want to talk to. Let me introduce myself a little bit more, and then I'll have Denny introduce herself, and then we'll get started with a bunch of questions. So, like I said before, my name is Jodi Mullen. I am a counselor educator at SUNY Oswego. I coordinate the mental health counseling program here, as well as the play therapy graduate certificate program. I also own my own clinical practice, and that's called Integrative Counseling Services. I'm lucky enough to get to do this all over the world and supervise lots of people, and that's actually how I met Denny. So the other thing that maybe you should know about me is that I've been doing play therapy for over 25 years, teaching play therapy and supervising play therapy for 23 years. So I have a little time and experience under my belt, and hopefully I'll be able to address these questions in a way that will be helpful to you. So thank you. Denny, would you go ahead and introduce yourself a little bit more?
Sure. So I'm Denny. My name is Danielle, but I like when people call me Denny, so that's my nickname. And I currently work at the Baltimore Child Abuse Center at the Family Advocate Supervisor, but I also do therapy part-time with an agency. And so I met Jodi because I'm actually in the process of becoming an RPT. And so I had the opportunity of meeting Jodi, and she's one of my favorite trainers. And so I wanted to ask her a lot of questions because I do in-home therapy, and sometimes it's hard trying to do a lot of those techniques. And so I'm hoping today that I can get a lot out of this because it's really, really hard sometimes. And sometimes you don't think you're doing nothing. And sometimes you feel like you're doing a lot of directive, but I really want to focus on some child-centered. And so that's why I am here today. So I'm hoping that this helps me, but also helps a lot of other people who are doing the in-home therapy, because I don't even know if I've been to any trainers that even talk about in-home play therapy. It's more so, oh, we're at the agency, we have this. And I'm like, well, I'm in the car, I'm in the playground.
That is so true. So sometimes, I think, thank you so much, Denny, for agreeing to do this with me too. I knew Denny had a bunch of these questions, and I thought, you know what, I know there's lots of folks out there with these questions. So Denny's kind of acting as your ambassador to get your questions answered. So one of the things I want to say, first off, is absolutely, can you do child-centered play therapy? It's not an if, it's a how, that you can do child-centered or any other kind of play therapy when you're working in home-based kind of situations. And I do think that it doesn't get addressed. So usually when you go, I agree with you, when you go to play therapy trainings, typically it's about either play therapies in clinics or, those kind of settings, or it's play therapy in the schools. And so some of those things so some of those adjustments that are made for schools may work during home-based, but then you have a whole bunch of other kind of things going on for home-based as well. And one of the reasons why I feel like I have a good sense of this is that early in my career, I did home-based counseling. I worked in an agency where I was sent into the homes to work with the children who were at risk of being placed in foster care. So, so I kind of remember what that was like at the time too. So, something that Denny did beforehand was she sent me a bunch of questions that she wanted to ask. So, what I'm going to do is I'm going to just read one of the questions that Denny had already forwarded to me, and then Denny can elaborate or add to it, just because you're still out there in the field trying to do this work.
I can probably give you a good example too.
Okay, yeah. So there's that as well. So we figured we'd do about a half hour here. We might need more time, so at least we'll get you started. So one of the questions that Jenny had here, which is, I think I'm going to start with this one because in a way it's the simplest of the ones that you gave, is how can I still do child-centered play therapy with minimum toys or items? Okay, so there is resources out there on this, and actually one of the things that you'll find attached to this video, or we'll give you a link for, is a list of toys or items that are easily made portable, so that if you are doing home-based work, or even if you're going from school to school, which a bunch of people wind up having to do as well, is that you could carry your stuff. So I'll provide a list of some of those things, but I'll talk about some here now too. The other thing that I wanted to really point out here is, especially if you're doing child-centered or any other kind of humanistic kind of play therapy, the toys or the items are secondary or even tertiary to what really is the change agent. The change agent is the relationship that you create with that child, and it's the space, sort of the therapeutic space and alliance that you create with that child. So the toys and the items become like less important when it's really, the change is really based on what's happening in the relationship. That being said, there are some toys that I think you really want to make sure that you bring, and they should have in all of play therapy, kids are going to show you, regardless of why they're referred, regardless if it's home, school, or office-based or clinic-based, regardless what kind of approach you're taking, children are going to show you some things in play therapy. They're going to show you aggression, they're going to show you regression, and they're going to show you expression. And so you want to have at least a toy or two that's going to allow them to aggress.
Okay.
So that's really simple in many ways, because they're going to make a toy an aggressive toy if they need to, right? So
yes.
What we like to use is those foam noodles for the pool.
Oh, yeah.
Yeah, you know what I'm saying? And you can just cut them in half. So they're really inexpensive and they're pretty durable. So you can get them at the dollar store, someplace like that. You cut them in half and you have swords, or you have telescopes, or you have witches' brooms, whatever it is that the child is going, to make that. But now you at least have the potential for a toy that could be seen as aggressive.
Okay.
It's not a difficult limit to set either, which is something that you would need to do with any kind of aggressive play. So there you have it. It's inexpensive and it's light, and that's an important thing.
And Jodi, I'm so glad you said cut it, because I was thinking, like, if I'm in the playground with these big noodles, like, are people gonna think we're crazy?
Yeah. Well, people are gonna think we're crazy anyway. We already know that, right? So, but yes, cut them in half or even thirds if you have to, depending on the space that you have in that home, or whatever. But the other thing is they're really lightweight, so they make it easier to carry, because also you don't want to have to go from you don't want to have to be a regular at the chiropractor because of carrying your play therapies.
Right.
So you want to have that. As far as expressive toys goes, toys that are going to let children express, those are your art supplies. So those are your washable markers and some plain paper, or a bunch of crayons or colored pencils. I think the washable markers are your best bet, because in terms of if you're throwing them into a bag or a bin to move, that you move around with, is that they're more durable than crayons and colored pencils. And you don't have to carry anything to sharpen with. You just have to make sure that they're, you just have to make sure that they don't get dried out. Which and that can happen if you leave them in your car. So again, another tip for doing home-based stuff is there's certain markers you don't want to leave in your car; they'll get dried out. So that takes care of the expressive. And as far as regressive, certainly I think you want to have a baby bottle. You're going to need something to clean that. So you're going to, I would say, as part of your kit, is you want some sort of wipes, or there's actually stuff that you can even spray that will disinfect and clean. And also a baby doll. So many children are going to need to show nurturance play. So I would say some baby dolls would be an important thing there. Other things that would be, we could probably just do a half hour on this, Denny.
Okay.
Other things that would be important to include in a home-based kit, something, again, lightweight, like an empty cereal box or a empty egg carton. And the reason why you want to have those is if a kid is getting aggressive and you need to set a limit, you can redirect them. You cannot destroy this, but you can destroy this, right? You can't step all over my markers or break that toy. break the foam noodle,
Right.
but you can step on the empty cereal box or the egg
Mhm.
carton. The
Okay.
other reason I would use cereal box, egg carton, any kind of like food container that can be cleaned out, that's cardboard and doesn't have yucky stuff in it, is that those also can be used then for play kitchen stuff. And again,
Oh, okay.
very lightweight, not very
Mhm.
durable, but very lightweight. One way to weave culture in is to also use empty spice containers or ethnic food.
Okay.
Yeah, so spices, are super culturally dependent, and so just
Mhm.
having some different, and even when you clean them out, they retain
Now.
the
Mhm.
smell. So that's nice to have in there. Again, pretty lightweight, and even like the little containers are going to fit nicely into your kit that you bring. So along with the regression part and regression play, that's what a baby bottle is great for, that. But just have some nurturing stuff. Many of the kids we work with have to kind of redo, maybe even from a psychoanalytic standpoint, they have to redo some of the things that have gone on in their lives. So you want to have
Mhm.
some of those things as part of that. So certainly I would add other things in there that you're connected to, but you
Mhm.
should never have anything in your toy kit that's super valuable, that has a lot of meaning to you, or that breaks really easily. And that's
Okay.
aside from the things that I already mentioned. I would have at least one mask in there too.
Okay.
A lot of children feel like the need to show another version of self or try
Mhm.
another version of self on, and that just makes that easy for them to do. But I will include a more comprehensive list. I just think that, like I said, that'll take all our time if I keep going on that verbally on that, answering that question. So those would be some of the necessary toys, but you really don't have to have a ton of toys or items with you in order to make child-centered play therapy work.
Okay.
In fact, I might have even told you this story before, Denny. I worked in a school where the office I had was a closet. It was 5 by 4. And so, as you can imagine, the child and myself barely fit in the room. So
Right.
there wasn't a lot of toys. Again, and other simple things to have in there. A ball is a great thing to have in there because you can even roll it back or forth.
Mhm.
Good for competency play and relational
Okay.
play as well. So those would just be definitely some of the first kind of things that you want in there.
Okay.
Nothing real elaborate. That's a cool thing about child-centered. The toys are very basic. Okay.
Okay.
Um, uh, any follow-up on that, Denny? Or that's good.
No, that's good. And I actually was able, someone helped me create like a stove with just a kitchen with a Tupperware. So
Yeah.
it's just plastic burners on it.
Yep.
But then, okay, so I had a bloopers child-centered moment.
Oh,
So I
good. Let's share.
got like the pots and pans.
Yes.
So I go and my client says, well, what am I supposed to cook with? And so I said, oh, remember this, you can imagine whatever it is. I said, oh shoot, where's the pots? You forgot.
You know what? And I'm so glad you said that, because another thing I would say, and I happen to have some handy right here, is this is all you need, right? Is you just need
Oh.
some plastic or paper, utensils,
Mhm.
plates, that kind of thing.
Okay.
Again, easily replaceable, not costly, that kind of thing, to use for there. I
Mhm.
will say, and maybe I can also include these links, is there some, just what you're talking about, I actually saw on Pinterest, and I was
Mhm.
like, that's such a great idea, because you can use like a Tupperware or Rubbermaid
Yeah.
bin, draw on, create on the top of it something that looks like burners, and then still carry stuff in there,
Right. Mhm.
like a portable kitchen set. And a kitchen set for me in my therapeutic playrooms, that's the most used item in my
Yeah.
playroom. So to have that is terrific. Okay,
Mhm.
cool. So here's another question that you had. What can I bring to someone's home when there are multiple kids? So tell
Mm.
me about that challenge a little bit, that comes with when there are multiple kids in the home.
So with that one, so I have a case now. So there are 5 kids in the home. And so one of them was their younger brother, who is a toddler. And so mom had given me, like, I guess it was like their playroom, sort of say. And
Yeah.
so when I would go to the playroom, it's like, and he would always seem to find me. It's like, as soon as I would come, he would just come out of nowhere, right? And I'm like, okay, all right. So I would, like, we would close the door, but he became so aggressive that he would like he knew how to like get in the room.
Yeah.
And so the mom, you know, I had even talked to her and said, hey, would you be able to, like, you know, give us a few minutes so we can have the session, but she never controlled the child.
Yeah.
And so a lot of times what I had to do is like bring in something else, but then I felt bad as a clinician because I felt like then my client doesn't have this one-on-one time with me.
Right. Right.
Because the sibling is just bombarding the sessions. And even though he was younger, I still felt bad because I'm like, this is her time, this is her space, and here he comes like, boom.
Yeah, yeah. And a number of the people that I supervise who do home-based work have said, you know, they'll even be a sibling on the other, you know, that they'll have a designated space in the home, but there'll be a sibling like on the other side of the, you know, knock-in or whatever. And so, you know, some of it is just being kind of flexible about the disturbances you're going to have in a you know, right? But I love your idea about like, what can I bring when there's multiple kids? Because it is a weird thing for you to go into a home. I think even culturally, like the cultures that are most salient to me in my upbringing and whatnot, it would be weird for me to go to a home, pay attention to one child, and not at least have something, you know,
Right.
for another kid. So I think one of the things that you can do there is really have something really simple, a coloring, you know, a coloring sheet, or make a paper airplane with them, you know. I think the tricky part becomes who is your right, it's who is your client. Those
Right.
other children or other child, that's not your client, so you're really not supposed to do that. So the other thing is having an activity that the parent or the caregiver in the home can do with that other child or children while your child is getting, the child you're working with is getting attention from you. There's all sorts of good reasons to set it up that way, because
Okay.
then as the child you're working with is getting the one-on-one attention from you, other child, let's just say there's one other child in the home, is getting the one-on-one attention from the other adult, from the caregiver. If it's multiple children, again, they're still getting more attention when one child is pulled out. But you might even want to frame it that way, is yes, I'm here to see, you know, sibling. And when I get to be with your sibling, you get to be all alone with your mom, you know, something
Right.
that you're really kind of making it that way. The other thing I would say is, you know, definitely talking with parent about like, well, what would that other child really, you know, like? Because I think that just helps with parenting in general. Like, is this a child who wants you to just read with them, or would like you to play a video game with them, or like to take a walk with you, or, you know, what kind of things can you do? And then then I think then you can act more of a consultant to the parent about what they can do with the child, or what they can get the child occupied with while you're working with the other child. Make sense? Okay.
Yeah, I think so. And I think one of the challenges I had with this particular family was that it was a family that the parents didn't buy any toys.
Oh, okay.
So it was like, oh, like the play lady is really coming here today, you know, with the toys. And so I think that's why, like, you know, some of the kids would be a little bit more aggressive, because it's like, oh, like she has this and we don't know what this is like, but we know when she comes, it's, you know, for them, it was like fun because it was new things that they got to explore with.
Yeah, yeah. And I think that's hard too, because you're there's all sorts of tricky parts of that one, because you're in their home, and if they don't want their children to have toys in their home, albeit that that doesn't make a whole lot of sense in terms of allowing their children to grow and learn and that kind of you still have to respect that it's their home. And you know, that's definitely one of the things that lingers with me from doing home-based work, is how much, you know, you're in another person's home, and I don't I never wanted to be, one of those people who comes in and sort of, well, makes judgments about their home or the way that they should be doing
Right.
things. So, I think that's kind of iffy there. But maybe that's also one of those ways that like the kitchen we were talking
Mhm.
about. Maybe that's something that you could do there too, is say like, listen, if it's okay with the parents, I made an extra one of these that you guys can keep at home.
Yeah.
Something like that. But I think it's super challenging, and that's why you ask the question. You don't ask me unchallenging questions. Okay, so did I answer that one good enough?
Yes. Yes.
Okay, so another one is that you have on the list that you sent me is, how do you engage a parent when they are hopeless about the process? So do you mean the play therapy process, or their kid improving in their behavior? What kind of process did you mean there?
So for me, I think it's kind of more, I don't want to say it's more of the process as it relates to play therapy. I think it's more so of the process of families feeling it's not working because they feel that you come in with this magic hat. And so when you come in with toys, it's like, well, when you leave, it's still here. Or you see progress in the child with you, but because the parent doesn't implement the skill,
Right.
They see the progress. And so like, you're kind of like, okay, like this is a balance in that here.
Okay. So one of the things that I do with parents frequently, and this is home-based or otherwise, is I seed plant, right? So the way that I think about it is I'll say like, hey, I don't know if you've seen some improvement in just how much more patient your child has become, but I'm seeing it in the playroom. So my guess is you're going to start seeing it at home. Can you look for it for me? So I'm actually, the way that I think about it is I'm like, here are the glasses I look at your child through.
Okay.
It's like, now I'm going to give them to you to see if you can wear them every once in a while. So I sort of set them up for that. For being able to see that. So two things here. One is I always document in my case notes, and I actually have a form where it's like a checklist, so I can also share that. I'm just going to write myself a note saying that I said that. And then Pinterest, I'm writing all the things down that I said, and then list of toys. Okay. So another thing that I do is in those case notes, I document any pro-social skills or ness that I'm seeing in the child. So in the case notes, I would put like that the child showed empathy, that they showed a good sense of humor, that they had reciprocal play, anything like that I would put in there. And then those things I talk to the parents about, all the pro-social skills, not all at once, obviously, but I'll say like, hey, just so you know, your child used a lot of manners with me today. That must be coming from you. Are they using those at home? I'm just curious. And if the parent's like, no, then I'll say like, I bet they're going to start because they're using them in the playroom. So you really pay attention to that between this week and next or whatever, so that you're sort of setting the parent up so that they can see it that way. I also do that with teachers too, so in school-based stuff, I'll say to the teacher, I know you're probably not seeing this in the classroom yet, but that should start happening. So if you could look for it, that would be fantastic.
Yeah, I will say that with this particular family, because I wasn't seeing a lot of progress with mom, I figured I had to do a lot of other progress other ways. And so I ended up reaching out to the school. And so the school was on board with their individual teachers. And so I was like, okay, great. And so like literally now the teachers email me with a weekly progress. And so then I'm able to like take it back to mom. Because mom is kind of like in a stuck place when it comes to the kids, and to the point where I had to reach out to her therapist and ask her like what was her expectations of me as the child's clinician. And that her therapist informed me that it was more so like she wants them to change their behaviors. And so even she had to tell her like, well, that also requires you to enforce things. So it was like, I felt like it was like a battle in the beginning, but then I had to like pull in like my outside resources to really help the family. So I felt like I had to rely on other systems to really help these kids really even see their progress, because I think they didn't even see the progress in their home. And so now that they know their teacher is giving me a weekly progress, they're just like, okay, like we know things are going to be different now.
I think that's terrific. That was such a creative way to do that. Is like how many more people can we pull in that may be supportive of this?
Right.
And then you get that snowball effect where you start to really see it build. Two more things out of what you just said. I also have weekly progress sheets that I have a parent version and a teacher version. So I'll see if we can put links for those up here as well, connected to this video. And this way people can use those. I have some parents who do it, some parents who don't. That's not that's not my problem, but it doesn't matter whether it's home, school, or agency based. It would work in any of those.
Right.
And then the other link that I'll put up is that we have some links for about child development, and I think we broke it up from 3 to 6, 7 to 9, something like that, 9 to 11. And three different phases of child development, and we have webinars that are for parents on child development and webinars that are for clinicians on child development. And the reason, especially clinicians who are using play therapy, so what it would look like in the playroom. The reason why I'm saying that is that, like you were talking about mom's expectations, and a lot of times the expectations do not meet where the child is at. And I'm actually thinking of this example. We had a parent call, wanted her 5-year-old to be seen for counseling because, and the reason was, dun, dun, dun,
oh boy,
he wasn't taking kindergarten seriously enough, and all
he wanted
to play, right? So probably play therapy probably wasn't going to go over well with her. But to just sometimes parents hear messages or don't have the opportunities that we've had in terms of learning about child development to know, they're right on target, and or our expectations are so far off that no wonder our child is struggling because of that. So I think that those might be some useful resources.
And I was going to say, Jodi, if I can add a point for the people who are going to do the behavior sheets, to like what I did with my clients, I had them make up the goals. And so it was so achievable. So like one of my, actually it's a set of twins, one of them walked out the class. I'm like, you're in first grade. Like, where are you going? Right. So I made sure that they were goals that they could actually look at and achieve, because it was something that they knew that they wanted to work on. Because I think sometimes we look at these kids and we're like, oh, they can't make up their goals. But clearly they truly can make up their own goals because they know what they are doing and they know what's right and wrong. And so I think that definitely helped my clients because it was, every time I would see them and they give me an update, they'll say, but I didn't do that.
Right. Yeah. So they can see some of those things. That's such a great tip. Thanks, Denny. You do have more questions on here, so we might have to make a part 2 or something like that. But I do want to take one more question, because I know this one's particularly important to you. And that's about self-care. So you want to just go ahead and ask the question, because I know this one's really important.
One thing is, because you are in the home, you see so much. And I've always been a clinician that says that when you do agency-based, people aren't really factual. But when you go in the home, like, you literally see all the factual information that they hide from you in office.
They hide it, right?
Yes. And so when you see that, it does take a toll, because you kind of want to do more. And so it's not, I don't want to say you're overstepping your boundaries, but it's kind of like, you just like, oh, like, I don't want the kid to be in this situation. Like, so what can I do more as a clinician? And I feel like you just do more, you do more, you do more. And it starts to take a toll on you, but you really don't realize it takes a toll until you've done all these other things. And then you're just like, why am I so exhausted and drained from this?
Right. It's a boundaries thing, but it's made even more complicated because you are in their home and you are, for lack of a better way of saying it, the way that they live,
Right.
So, and again, this is a theme or question that I hear from a lot of the people that I supervise who do home-based
Mm-hmm.
work, is like, I can see that they don't have, they don't have
Right.
anything, or they don't have a washer dryer, what can I,
Mm-hmm.
help them with that. I'm going to go back to an answer that you already had about, like, well, that you don't have to do it all, right? That you can
Right.
say, like, what are the support systems? What are the support systems?
Mm-hmm.
I'm thinking to a little boy that one of my supervisees was working with, doing agency based, I'll say, and the child, and I was doing consultation with the mom, and their clothing really had a terrible odor to it.
Mm-hmm.
It was affecting this little boy, because the other kids were making fun of him and
Right.
being near him. And so I, talked with mom a little bit about that, and she said, "Listen, we don't have a washer dryer, and so I do our laundry by hand, and sometimes it doesn't dry the
Oh, wow. Mm-hmm.
so it has that kind of smell to it. So I'm not going to go out and buy her a washer and dryer, although I'd love to be able to do that, like some Oprah sort of way. But
Right.
what we were able to do is I called the school and I asked them if they had. First, I asked her permission if I could
Mm-hmm.
investigate if there was some ways that we could get their clothes washed for them, at least her sons. And I called the school, and the school said, actually, we have a washer dryer in the home economics,
Oh, right. Mm-hmm.
and that some of the other schools, even if they couldn't do it at his particular elementary school, some of the other schools in the district had for washing the athletic um, uniforms.
Oh,
So mom would drop off, a load of laundry to the school every week, and that's how that got done. So, so sometimes I think it's like, okay, looking outside the box so that you don't feel like you have to do it, but recognizing, and I think you and I maybe have talked about this before, that the worst thing that happens to us helpers is feeling helpless, right?
yeah.
And
Mm-hmm.
and I think sometimes when you're in the home, you feel like, okay, yes, I'm maybe being helpful, clinically, but there's all these other things that things that this family could benefit from. And so I think that that is about setting up certainly professional boundaries, but also what are your personal boundaries, and just recognizing that you can really care for and care about the kids and the families of the kids that you work with, without doing that. So self-care,
Mm-hmm.
right? It sounds so cliche, but self-care becomes really important. One of the things I have to do a demonstration of this. So one of the things that I would sometimes do after I left a home, because I would feel like a lot of their emotional, kind of psychological, relational
Mm-hmm.
stuff got like left on me. Not
Yeah.
what my work with the kid, but the whole dynamic of the household. And so I would like get out of the house, and I would kind of like wipe, like just like
Uh-huh.
literally wipe it off me. Open the windows in my car as I, drove away. What kind of music am I listening to, or what kind of talk radio do I need?
Right.
Podcast do I need? But even making like a sort of zen, spot for yourself in your car. Do you have like a nice smelling essential oil, or can you have is there a cup of tea that's going to still kind of bring you that self-care feeling, even if it's cold?
Right.
What are some of the things that you can do, like where you just recognize, I just did what I did, what my
Mm-hmm.
job is as a helper, but also what my role in life as a helper is. So, really just having a plan, for yourself, where I just did what I do professionally as a helper. And,
Mm-hmm.
so many of us come to this work because, not just because we're professional helpers, but we've been wired this way. This is the
Right.
work we have to do.
Mm-hmm.
And so now I'm going to do something for me. And even if it's, just a little breathing in your car, to take a walk, like a quick walk, a 5-minute walk in between
Mm-hmm.
clients, to wipe off what gets left,
Mm-hmm.
so to speak. And what I would say is to have at least 4 or 5 of those things that you can go to, that you can make happen while you're in your car, transitioning from home to home. Because some days, doing some nice breathing, grounding breathing, or bubble breathing, and
Yeah.
will be helpful. On other days, you're going to just need to listen to like 80s acid, and just rock out. And so just having a couple of different things that you can do that help kind of center you. And I think the other thing is, depending on the area that you're driving in, if you have to from home to home, or
Hmm.
you have to go through areas that are really high traffic, you don't get to go like, you know,
Right.
so finding, different ways that you can take care of yourself so that you can continue to do the amazing work that you do. So,
Yeah, it's funny when you was doing your shake and dance, because usually when I'm doing that, I'm really trying to make sure nothing's on me, right?
well, it might have started that way in a couple of situation, but I still do it. So it has staying power.
Yeah.
So it's both practical and
Yeah, because it's times where I'm like literally putting on light clothes.
yeah.
Like, okay, gotta wear light clothes at this time. So yeah.
Well, and again, that's another way of taking care of yourself.
Yeah.
That you would be very upset, if you did have roaches or some
Yeah.
clothes, if you sat in, for some people it's like, what did I sit in, or
Hmm.
and I think those are our little idiosyncrasies, but also our ways to take care of ourselves and
Yeah.
keep ourselves feeling safe, psychologically, emotionally, socially, relationally, physically, all those
Right.
different kinds of ways. So, Denny, this I think has been. I mean, I love talking to you. You already know that, but I think that we did a really nice job, at least giving people answers to some of the questions that you put forward, and helping get the word out there. So we'll have to figure out if we need to do a part 2, or maybe even a little bit of a webinar or something.
Yes, I am down.
Okay, cool. Sounds like a good plan then. So Jenny, I just wanted to really thank you for like motivating me to do this and giving me an opportunity to answer some of these questions that I know you aren't the only person who has. So I really just want to say I'm really grateful for that, and for our relationship. So I look forward to being able to talk with you specifically, but about play therapy again. It was really fun. Thank you.
You're welcome. And thank you for being so open to do this, because, I've asked questions to a lot of people, and it's just like, oh, I can't help you,
Yeah.
So I really appreciate you being able to really help me, but even being able for us to do this to help other people, because I think some people are just nervous to even ask because it doesn't seem like the norm.
Yeah.
So I'm glad we do have this opportunity.
Yeah, and I think in that way you really can serve as like almost like a virtual mentor, in that like you said, that you were a participant in a presentation that I did, and you just asked me, and
Right.
like you can email your presenters if they gave you their emails. Email them and you can ask them questions, and if they need to set a boundary around that, then they'll set it. But something like this also may happen. So I just think that's a great example for taking a chance, and the worst thing I could have said was no.
Right.
But I didn't. So thank you again, and thank you everybody for listening, and let us know if you have more questions, because like I said, we will probably develop this a little bit further. Thanks again. Bye.
Bye.